So I'm going to go through on how to pass your Dermatology SCE exam to become a consultant dermatologist. Hi, my name is Dr.ErmaDerma and I'm a resident dermatology doctor that is currently working in the UK, and I passed my Dermatology SCE first time just 6 months in my training. So if you're in training and you need to pass the exam to become a consultant, or using this exam to bulk up your CV and to get portfolio points, then I'm going to give you tips and techniques on what I use to pass this exam. So first things first, we need to find out the format of the Dermatology SCE exam. So the Dermatology SCE exam is usually an 8-hour exam where it's split into 2 parts and you have a lunch break in the middle. It's usually a best of 5 multiple choice question and answer base, and sometimes you have images in your questions. If you are taking in the UK, this is usually done in driving test centres, which can get a bit awkward since you're getting images of genital areas and weird rashes on your computer screen, and sometimes 17-year-olds and 18-year-olds are walking past a computer. But don't let that faze you, and you just need to get over the embarrassment and just focus on your exam. If you want to know more information on the Dermatology SCE exam, you can go on the JRCTP website and can go on the SCE page and just read a bit more on the format of the Dermatology SCE exam. So I understand year after year the exam is getting harder in terms of the pass mark is getting raised. So if we look at last year's pass mark, 2022 and 2023, the pass mark was 77.4%. And I would heavily suggest that you do go through the SCE Dermatology website, because it actually tells you on what dermatology topics that they will assess you on, and gives you a score breakdown on what each individual topics would be assessed in the exam. So this should tailor your revision on what you should concentrate on more, since if one of the topics is only giving you 5 marks and yet the other topics is giving you 20 marks, then definitely do focus on your revision on the ones that is scoring you 20 marks so you can pass the exam. So the resources that I used, the first resource that I used, and every single person that actually passed the exam and previous consultants, they had used the Sima Jain book. Now, the Sima Jain book is just called Dermatology Illustrated Study Guide and Comprehensive Board Review. Now, I would heavily recommend getting this book and read it from back to front and just learn it off by heart. I know it's very difficult to learn a whole book off by heart, but it just gives everything in a succinct and concise manner and gives you tables on what you should concentrate your revision on, and also gives you helpful tips and tricks on how to remember some genodermatosis as well. So definitely do get this book. This is what's going to make and break your exam. So since you'll be assessed in cutaneous allergy, what I would advise is to actually go through the British Cutaneous Allergy Society's website and actually go through the patient information leaflet on all the allergens and just learn that off by heart as well, and what allergen is associated to what occupation as well. And make sure you also test yourself so you know what allergen is also associated with an occupation, and also how allergens present themselves clinically. So for dermatopathology and for histology, so I really struggled with this since I didn't really focus on learning about dermatopathology and histology during medical school. But one resource that I definitely used and actually just really helped my histopathology and dermatopathology is actually a YouTube channel called Gerard Gardner, and he breaks down dermatopathology and histology in such great videos and makes it very easy to understand. So definitely do access his videos early on and just go through each individual playlist and just go through all of his YouTube videos. And of course, go through practice questions. So one practice question that I did was called Study PRN. Now, Study PRN is very suited for our UK Dermatology SCE exam, and it really gives you great insights on your answers, especially if you get things wrong, and then it just gives you a breakdown on why this was wrong and gives you the answer as well. So make sure you make down notes on what questions you got wrong, and then you can just refer back to them just as your own practice before your exam. I think some people also ask if Dermin Review is a good database to practice your questions for the Dermatology SCE exam. So I found Derm in Review actually harder than our actual Dermatology SCE exam, and it's more suited for American clinical practice for dermatology and not necessarily the UK practice guidelines, since the Dermatology SCE usually focuses on UK guidelines. Derm in Review, although it's a great resource and it really goes through in depth and details on the pathology side of dermatology, is just that you may not appreciate the management side of UK practice guidelines for dermatology. So this is the reason why I didn't use Derm in Review. It just wasn't suited for the SCE exam in terms of my point of view. But if you're finding it really helpful, then go ahead. So some people asked, did you go on any courses for the Dermatology SCE exam? So some people asked me if you went on courses for Dermatology SCE, and yes, I went on 2 courses. One of them was the St. John's Dermatology SCE one, which is a 2-day course where they just go through all the key topics which you'll get tested on for Dermatology SCE and go through questions as well. And they also give you handouts, and I thought that was very useful because I actually made notes on those handouts and actually used them as revision notes as well. The other one was actually done by a drug company, and I thought that was great as well. I think it was around 2 or 3 day course, and it just went through all the possible questions and answers that you could go through as well. Now, the other thing which I heavily recommend that you do is that to read and learn and make notes on the guidelines from the British Association of Dermatologists, and that's for the skin cancer guidelines such as BCCs, SCEs and melanomas, toxic epidermolysis necrosis, and other management guidelines such as acne, HS. What we did, we actually formed an SCE group with all the other registrars who were taking the exam, and we just said to all the dermatology resident doctor, which topics do you want to make notes on for the guidelines? And then we all just went off, made notes on the guidelines that we designated to. We just shared our notes together, and that just really helped our revision as well. I think some of the questions do keep on coming up again is genodermatosis. What I would advise is, again, get your Sima Jain book and just learn your genodermatosis off by heart. It actually gives really great acronyms that you can learn all your genodermatosis off by heart. So there's always going to be an exam question on epidermolysis bullosa. So what I did is I just got a blank sheet of paper and just drew all the layers of the skin and see which variant of epidermolysis bullosa affected which part of skin, and just made a few key points on the clinical features of each variant of the epidermolysis bullosa, and that just gave you a visual representation of all the variants of epidermolysis bullosa and where it affects on the skin, and also the key clinical presentation of them as well. But also, it's usually your own clinical practice in dermatology which also helps answering the exam. And although I did the exam 6 months into my resident training in dermatology, I did have previous dermatology experience. So I did a 6-month clinical fellow job, and I also had 4-month experience during my IMT job as well in dermatology. So that experience really helped with the exam as well. So my general tips for the exam is just get a good night's sleep before your exam. It is a very long exam. You also have a lunch break in the middle as well. Take any notes with you before so you can quickly revisit them, and also quickly revisit them during your lunch break. Of course, you cannot take the notes into exam since that would be cheating, and there will be a serious GMC probity question on your name as well. If you get stuck on a question and you feel like all the answers sound the same, then just use a process of elimination to find out what the right answer is. Of course, if you're completely stuck and all the answers just sound the same, just guess and just move on, and you can always revisit that question later. And just prepare as early as possible for the Dermatology SCE exam, because the Dermatology SCE exam should also help in your dermatology training as well, and just build that knowledge up. So even if hopefully not that you will fail the Dermatology SCE exam, just know that this is also helping your dermatology training and your knowledge as well. And if you're taking this exam to bulk up your CV or to get portfolio points, then you may be interested in my video on how to build your portfolio in dermatology. Good luck.